in the case of mitral stenosis, due to a stenosed mitral valve, there is a large amount of blood in the left atrium and it cannot be emptied completely in the left ventricle during diastole. So what happens? The left atrium dilates. And usually atrium has good capability to dilate and failure occurs late. So ideally what happens is the left atrium keeps on dilating and the pressure is transmitted to the pulmonary veins, then capillaries, pulmonary artery, and through the pulmonary artery the pressure is transmitted to the right ventricle, and the right ventricle is what first fails in the case of mitral stenosis. So in the case of aortic stenosis, what happens is the left ventricle has to pump blood against a narrow aortic valve, so it will hypertrophy over time. Left ventricular hypertrophy occurs and due to the increased pressure in the left ventricle, and it will pump blood and maintain the cardiac output. So in aortic stenosis, left ventricular hypertrophy occurs rather than failure. And by the time failure occurs, the patient will die if there is no intervention is done for the patient. So in aortic stenosis, usually left ventricle will hypertrophy and try to maintain the cardiac output. Now let's talk about mitral regurgitation, where there is a leaky or a floppy mitral valve. So what happens? Now during diastole, let's say 100 ml of blood comes from left atrium to the left ventricle. Now the left ventricle has to pump 100 ml of blood from left ventricle to the aorta during systole. But what happens? There is a leaky mitral valve during isovolumetric contraction phase of systole, when ideally the left ventricle was supposed to be contracting against two closed valves. One valve is now open. It's leaky. So out of the 100 ml we said, 30 ml of blood is going back into the left atrium through a leaky mitral valve, which is called mitral regurgitation. Okay, so now we have 70 ml of blood which is forcefully ejected from left ventricle to the aorta. During the next cycle, what happens? Again 100 ml of blood is coming to left atrium. In the previous cycle, there was 30 ml of blood left in the left atrium, and now 130 ml of blood is coming to the left ventricle. Now again what will happen? 130 ml of blood will not be ejected during systole. There is again some amount of blood which is going back from the left ventricle to the left atrium. What happens? Now there is a volume overload status in the left ventricle because it cannot eject all the blood from the ventricle to the aorta. Some blood is always leaking. In the next cycle, again more amount of blood is coming from the left atrium to the left ventricle. So there's a volume overload status in the left ventricle and it cannot hypertrophy as such like in stenotic conditions like aortic stenosis. So the left ventricle failure occurs in mitral regurgitation. We know that regurgitant lesions are volume overload states and stenotic lesions are pressure overload states. With that being said, let's talk about aortic regurgitation. In the isovolumetric relaxation phase of ventricular diastole, the left ventricle is relaxing against one closed valve, whereas the other valve is open, it's leaky. So blood from the aorta is coming back into the left ventricle. During systole, what happens? It has to pump blood forcefully, or increased work is done by the left ventricle in order to increase the pressure over here to that more of the aorta. The pressure in the left ventricle should be more than that in the aorta, so that cardiac output can be maintained and through the aorta blood can go from the heart to other parts of the body. So in the case of aortic regurgitation, because of the volume overload, blood is coming both from the left atrium and also from the aorta during diastole. So what happens? Because of this, there is increased work of the left ventricle and a high output state is seen. A high output state is seen in the case of aortic regurgitation. So reinstating what we just spoke about, in mitral stenosis, right ventricular failure occurs as the disease progresses. In aortic stenosis, left ventricular hypertrophy occurs due to increased pressure in the left ventricle, and in mitral regurgitation, left ventricular failure occurs, and in aortic regurgitation, initially there is a high output state, and in the later stages of the disease, a left ventricular failure also occurs. Thank you.